Well, welcome to this talk. Now we're going to go to Wefwafwa Andrew, who is a clinical officer in Uganda. Now, Wefwafwa's actually gone to quite a lot of difficulty to get this talk to us. So the sound quality is not always absolutely brilliant, but I think it's quite listenable too. So please make the effort and listen to Wefwafwa, some really interesting insights about what's going on in Uganda. Thank you, Wefwafwa. And the first question I asked Wefwafwa was, tell us about Uganda.
Okay, so Uganda is located in East Africa, and it is bordered to the north by South Sudan, to the east by Kenya, and then to the west by DRC Congo. To the south, we are bordered by Tanzania, Rwanda, and Burundi. It is also commonly known as the Pearl of Africa, just because of its beautiful sceneries, mountains, wild animals, and all those things. I think, Doctor, you should consider paying a visit to Uganda one day.
I certainly will. Thank you, Wefwafwa. Yeah. And what is your job?
I am a clinical officer. I think you call clinical officers that side. You call them probably physician assistants. Mm-hmm. For us here in Uganda, we call them clinical officers. Mm-hmm. And I'm working with an organization called One City Ministries. I'm working in a clinic called One City Medical Center.
And is it a poor area in Uganda where you live, or is it quite an affluent area?
Yeah, it is a rural area. It's a rural area. Actually, it's one of the beautiful areas in Uganda. We have mountains and all those things.
Yeah, but is it a poor area, or do people have a lot of money?
Here, most people here don't have a lot of money. Mm-hmm. The largest proportion of people in eastern Uganda, they don't have a lot of money here.
Mm-hmm. So first of all, we want to talk about the COVID situation in Uganda, Wefwafwa. What is the COVID-19 situation like in Uganda?
The COVID-19 situation in Uganda is not very good. As I talk currently, we are under a national lockdown. This was declared following the rise in the new cases and then the deaths. That was last month. That's why the government declared a lockdown. In fact, during that month, we lost a total of about, in just 2 weeks.
But you lost what? You lost what, Wefwafwa? Sorry, what did you lose?
Like last month, we lost about a total of about 16 doctors within just a period of 2 weeks. So that was a bit worrying and it was of concern. So they decided to call a national lockdown.
So 16 doctors died from COVID?
Yeah, in 2 weeks. But as I talk, about 100 health workers are estimated to have died from COVID-19. But the Ministry of Health has so far reported 37 health workers.
But the real number is probably higher.
Yeah, it's higher just because also the testing is low.
So what is the situation about testing in Uganda? Are there lots of tests available?
Here they are trying to test, but not all that high. Because as you know, we have a population of around 44 million, and the majority of the population, they are just youths. Okay, yeah. So about only 1,400,000 tests have been done so far.
So just over 1 million tests for 44 million people.
Yeah, and yet COVID-19 here, we reported the first case. I think it was around mid-March 2020.
But recently the cases have gone up a lot.
Yeah, they have gone up. I think as per today, according to the Ministry of Health in Uganda, we have a total of around 89,974 cases. That is cumulative number.
So that's 89,000 tested.
Yeah. No, these are confirmed cumulative cases.
Oh, right. Okay. Right. But it's getting more in the last week or two with the Delta variant, I think.
Oh yeah. So about 66,080 cases have actually recovered, and we've lost, I think, about 2,324 cases as of today.
Okay. So if you see a patient, if one of your patients come to see you and you think they've got COVID, can you order a test for them, or can you test them?
In the beginning, they used to just test from Kampala. That is where our laboratory for the country, the main laboratory is, from the National Research Institute. But currently they have distributed some test kits, also RDT, but they are not widely distributed. They are just in main hospitals and some big private hospitals.
So have you got PCR tests where you are now?
So where I'm right now, we actually do an RDT if someone has the signs and symptoms of COVID-19. We do it if it is positive, and then we determine the severity. If it is mild, we treat from here, but if it is severe, then we refer them. But for patients with the negative RDT, we take off the sample for PCR.
Right, so you've got lateral flow tests and some PCR tests.
Yeah, there are not all that many. As I talk, we have a few. That's why you can see that since the lockdown began, since the pandemic started, we have only tested about 1,400,000 people.
Yes. Now you work. You're a clinical officer. You're working with patients all day, every day. Have you been vaccinated?
No, I've not been vaccinated because when I went to get a vaccine, I found in the regional hospital, I found that the vaccines were out of stock. They said that they were hoping to receive some vaccines. In fact, something like 2 days ago, they said that I think the government of Norway has donated some vaccines, around 285 something doses, to Uganda, but they have not yet arrived in the country.
285,000 doses.
Yeah, let me get the exact value here. It's actually 285,600 doses.
And the population is 44 million.
Yeah, the population is 44 million. And the target they want to vaccinate is around 21.7 million.
So you need another 21 million vaccines.
We need about 21.7 vaccines. But as I talk, about only 1 million. Let me get the exact value here of people who have been vaccinated. I think we have administered around 1,087,152 dosages. Yeah, doses. So, and out of that 1 million, the majority of the people, I think 80% of the total number, have just received their first dose, and only about 20% of the total number have received the 2 dosages.
And of course, we know that to protect from Delta variant, you need 2 doses.
Oh yeah.
So what we're saying is Uganda is basically unprotected.
Pardon?
We're saying Uganda is largely unprotected.
Yeah, it is largely unprotected as per now, because they say that we were getting actually vaccines from India, but due to the situation in India, I think they reduced on the export to cater for their population. So that caused us more trouble again.
Yes, you were expecting millions of vaccines from India, but of course they banned the export of the vaccines because
Oh,
of
yeah.
the pandemic in India itself. Now, what about the nurses, doctors, and other clinical officers that you work with? Have many of them been vaccinated?
Actually, many of them have not yet been vaccinated, according to the ones I've interacted with.
Mm-hmm. And
Out of 10, I think you can find like two. That's what I can say.
two
Yeah,
people have been vaccinated.
out of 10, that is like out of 10, the ones I've interacted with, I find like out of 10, I get like two people who said I've been vaccinated.
Okay, I'm actually finding this quite difficult with Wefwafwa to listen to. It's a bit embarrassing that you are working to save people's lives and yet you yourself are not vaccinated. And I really hope that you get it very soon.
Yeah, we are hoping to receive maybe vaccines very soon, and maybe I can get also my vaccine.
Mm-hmm. And as soon as they get them, you're ready to start giving the vaccines out to your patients.
Oh, yeah, sure.
So, have you seen many cases of COVID-19 yourself recently?
Recently, I have seen most asymptomatic patients, like
Asymptomatic.
asymptomatic.
Oh,
They are the ones
symptomatic. Yeah,
that,
yeah.
yeah, I think I've seen around five patients in the past 2 weeks.
And what sort of symptoms are you seeing?
Mostly, many of them, they report with flu-like symptoms, and then they also report with headache and then some fever. And a few of them report loss of no sensation, no loss of smelling actually.
Yeah, the anosmia, the loss of smell. Yeah.
Yeah, loss of smell, few of them.
So these are the kind of symptoms that we're seeing in unvaccinated populations. The old symptoms, the classic symptoms of COVID-19. And do you see people short of breath?
Yeah, some now those ones in most cases when we see that they are tending towards that side, we usually refer them. Patients like who have a temperature of maybe 38 degrees and above, those ones with the difficulties in breathing, and then also those ones with an oxygen saturation of less than 90% in most cases, we refer them. So they are mostly found in the ICU.
And is there currently ICU facilities available?
Yeah, they have set some ICUs in major hospitals in the country.
Do patients have to pay to go to those?
Yeah, these days, actually, when the president announced the lockdown, they said that the government is strained. Now they cannot afford to handle like paying for all those patients, their transportation, then all those costs. So they decided that patients will be paying for ambulance to be taken to the ICU and all those things.
But a lot of these people are poor, so how do they pay for transport and hospital care?
Yeah, that is what is worrying us because during the lockdown, people are not working, first of all, they are staying at home. So it is hardly difficult for them, like it is really difficult for them to afford that money. Because as you know, Uganda is also is still under the low income status countries. So most people here survive on a budget of around $1 the whole family a day. So you
Right.
can see that telling them to go and get all those things, it is difficult. And yet, COVID-19 treatment is expensive. So right now, the private hospitals have hiked the prices, and it has really become difficult. Most people,
How much is it to go to a private hospital?
yeah, private hospitals, they ask for something like above, I think around 20 millions for someone to maybe like recover Ugandan money. Some of them, they ask for around 1 million Ugandan shilling per
So,
day.
so that's about what, $1,000 or more?
1 million per day, that is around, I think 1 million per day is around 300 US dollars or 350 there.
Right, $350 a day, and yet
A day.
most families are earning $1 a day.
Oh, yeah.
So that means that the vast majority of your patients cannot afford to go to a private hospital.
Yeah, most of them cannot afford, and now some opt to treat themselves from home, and that is dangerous.
Okay.
Mm.
And if people can't go out to work with a lockdown, their income is even less.
Pardon?
If people can't go out to work because of lockdown,
Mm.
their incomes are lower than normal.
Yeah, people are not, as I said, they are not working, and it has really become difficult, mostly for people actually with other underlying conditions like hypertension, diabetes, and others can hardly access the hospital because they cannot transport themselves to the facilities. Some of them don't have money to go there, and some fear that they will be infected once they reach there. So it is a bit difficult for them.
So people could be developing complications from hypertension, high blood pressure, and diabetes.
Yeah, sure. And most people, I believe, they are dying. They are dying out there without being noticed because it is really difficult. Actually, that's the situation here. Most people actually they present at the facility with the complications of diabetes and hypertension. Uh, People don't have money even to screen, like for hypertension or diabetes. So most of them, even before the lockdown, they could just start home, and maybe you diagnose them when they come to the health facility, or some of them present with complications.
So very often the diabetes is diagnosed when someone comes in with black toes or kidney failure or blindness.
Mm. Oh, yeah.
Now, at the moment, have you got all the drugs that you need to prescribe?
The drugs that we need for COVID-19.
Yeah, and the drugs that you need every day at work. Have you got plenty of drugs?
Not really. Actually, the health system here is not doing well generally. It's not doing well even before the lockdown. People have been complaining. Some people don't have enough drugs, of course, like people with diabetes and all those other conditions, even malaria. Sometimes they can report to the facility when we don't have those drugs. So it is a common problem, not only during this COVID-19 period.
So sometimes a patient will come to you, you will diagnose malaria, and you don't have the drugs to treat them.
Yeah, that is common. Sometimes you prescribe for a patient a drug that will work well, but because they don't have the money to buy, and also you don't have it in the facilities, so a patient will opt to go and maybe get something else.
That's cheaper but doesn't work.
Yeah, but doesn't work. Yeah.
Do you have plenty of oxygen supplies?
Currently, like in our regional referral hospital here, we have an oxygen plant, but the government they have promised to expand it. They have promised to expand it. So far, it is not like a major crisis at this time around, right?
So if you need to put one of your patients on oxygen today, Have you got an oxygen cylinder you can use for that patient in stock?
It is really challenging because in most cases they produce actually very few, but they are just trying to expand. That's
Right.
what I've told us. It's not all that enough, but at least people can get oxygen, but we are still struggling still.
Right. So you're hoping supplies are going to get better in the next weeks?
Yeah, no, it may take something like maybe 2 to 3 months. You know, the government programs, they have a lot of procedures they follow.
So you need oxygen now and you might get some in 2 to 3 months.
Oh yeah, when you need like to have it, yeah, like to have it on high scale such that everyone can get it when you need it. You may need something like maybe 3 months.
And what about you? Have you got plenty of personal protective equipment to keep yourself safe?
Not really. Actually, even people in the lab in a nearby health facility, those ones who are testing samples, some of them are just using the common surgical masks. They don't have the N95 masks. So they just improvise, but we don't have enough of personal protective equipment. And this is why maybe the number of health workers dying is increasing one of these days.
So what are you going to do? You're going to isolate or are you going to carry on going to work?
Right now, it is difficult when people are dying and we stay away. So we usually use what is available to work on them.
But you're still seeing patients all day?
Yeah, we still see them.
Okay, Wefwafwa, that's really useful background. Thank you very much. Are people using local medicines, local herbal treatments?
Yeah, people are using local concoctions. They are mixing some things like oranges, garlic, and then also some lemons and ginger. And then we also have
Ginger.
yeah, ginger.
No, that's good. It's
Ginger.
good. It's good. Yeah.
Mm.
So
Then,
oranges and ginger are healthy foods. That's good.
And then also there are some herbal supportive treatments that have been availed, that have been manufactured by our local scientists, but they have not yet been approved by the WHO and the FDA.
But you can prescribe these local treatments if you think they're appropriate.
Oh yeah, we prescribe them. Some of them are helping.
Yes. Is vitamin D important with Wefwafwa?
Yeah, vitamin D is very important, and we recommend our patients here at least to have 20 hours a day, actually 20 minutes a day, like of sun bathing.
And do they get sun on the whole body or just on their head and hands?
They don't actually expose themselves. We've been just recommending, but personally, I've not been explaining to them that maybe they need to remove the shirt or something like that. We just told them that they have at least 20 minutes every day of sunbathing, whether they are patients or not.
Excellent. Yeah, that's very good. And of course, you're going to make vitamin D relatively slowly, but there it's a very sunny place, so it kind of it balances out. Yeah.
Oh,
Yeah.
sure.
Yeah. Is sunburn a problem in Uganda, or is it not so big a problem?
Pardon?
Do people get sunburnt in Uganda, or is that not such a big problem?
No, we get that problem here.
Oh, you do as well, right? Okay, so you need just the right time, just the right amount of time.
Actually, here we rarely get it. We actually, like, I've taken time without seeing it, so it is rare.
Okay.
Our
Yeah.
temperatures are always okay.
So it sounds to me like you're prescribing as good a diet as people can afford and the vitamin D, which is what people can do without money to pay for more sophisticated treatments.
Oh yeah, sure. And actually, I decided to start a program where I'm moving to the communities to teach people and also plant some nutritious plants like oranges, then ginger and all those others, because I realized these people cannot afford even to buy seedlings. So I've decided to be moving and then like planting these things as we educate people. Maybe in the future, they will be able to get these things for free.
So you go around poor areas, you do clinics, you treat the illnesses, you do minor surgery as well.
Yeah, we do minor surgery, but currently I'm not doing it from the community. Right now, I have started with the health education and then screening of hypertension and then diabetes. Because of the funds also,
Yes.
you cannot do the surgeries. I'm just trying to pick out of the little I have to do those things because I can afford them at the moment.
So you can do minor surgery, but very often you can't afford the equipment and resources to do that surgery.
Mm.
Yeah. And as you go around, you're planting nutritious trees as well.
Oh yeah, that's what I've tried to do.
You know, I do the same. I try and plant nutritious trees as well. It's really good that you're doing that. That is excellent. Now I've heard that you've started making YouTube videos. Is this true?
Yeah, actually, I have a passion of community sensitization. So I started this going to the community, and then also when I get some money, I use some local radios to teach people in their local languages.
Oh,
And then
local radio. Yeah, yeah.
yeah, local radio stations, and then I educate people about their health. And I also upload some YouTube medical videos, majorly for sensitization. I'm looking at the patient. So I try to make it simplified them so that someone can understand. Because personally, I'm also a slow learner.
Me too. Me too. Absolutely. Still learning.
Yeah, and because of that, actually, I benefited a lot from your videos since I joined the school.
Thank you, Wefwafwa. I'm delighted that you're using the videos.
I've been using your videos since I joined first year in a clinical school, just because I could understand what you were teaching, because you know how to handle us, the slow learners. So I've been using it. I used it in school, and even now I still use those videos to help me teach others.
Thank you, Wefwafwa. That's excellent. And you make videos in English and you make videos in local languages to educate people.
Oh yeah, I make some in local language and then more, and the YouTube major I upload English, but those ones are also mixed in local language. And now the community, when I'm going to the village, I usually go to the radio station, the local one.
Local radio station, yeah. Excellent. That is such good news. And how many subscribers have you got on YouTube?
Right now I have about 426 subscribers.
400.
Yeah, 426 subscribers.
Right. Okay. Just a minute. Right. Everyone who's watching YouTube, your algorithms get a lot better if you have more subscribers. So we want Wefwafwa to get a lot more subscribers really quickly, and that will help him educate local people. It will help him make videos in his own language. It will help him pay for the radio station, to plant nutritious trees, to buy drugs for poor people. It will help him do all of these things. All you've got to do is click that subscribe button on the link I'm going to put in for Wefwafwa's channel. Don't care if you subscribe to mine. I want you to subscribe to Wefwafwa's, and we will be putting the link for that. So please do that. So we'll be looking.
Thank you very much.
We'll be looking forward to more subscribers, Wefwafwa. That's great. So basically, I think what you're saying is that you had huge health problems already, often related to poverty. So related to infectious diseases like malaria. I imagine in children you get a lot of diarrhea.
Diarrhea, yeah. Most children actually, mostly under 5, have diarrhea and then malaria. Those 2 diseases are killing a lot of children here.
And if the mothers bring the children to you, you can normally save their lives by giving them oral rehydration therapy.
Oh yeah. Yeah, when they bring them, I can do that.
And you can train the mothers to do that at home as well.
Oh yeah.
And the malaria there is mostly falciparum malaria. You're able to treat that quite readily with drugs when you have the drugs.
Yeah, the commonest form here is the falciparum, and it is actually, I think it's one of the virus species.
It's one of the what?
Yeah, I think it is much violent than, it is virulent.
Virulent, yes, it's a very aggressive falciparum.
Yeah,
I'm just going to tell people watching that the falciparum malaria, or the falcipium malaria, is the one that causes cerebral malaria. So if that's not treated, people can go into a coma within hours and they can die.
Yeah, sure.
But you're able to treat that.
Yeah, I'm able to treat that, but what hinders people in most cases, it is poverty. Of course, they cannot afford to buy the medication. Sometimes they can come to a government facility and they don't find the medicine for malaria. And when they go to the private, they don't have money. So sometimes many are forced to either buy one drug or 2 to swallow, and then they end there once they feel better. So some of them are actually underdosing. They don't complete the whole dosage because of financial problems.
So you had these, and what about the diabetes? Is insulin available?
Insulin, most people just buy it. It is not readily available. At least on the patients that I've worked on, in a facility where I was working, it was a government facility, and most of them were buying because many people were coming and we had very few in stock. So most of them just buy, and it is a bit expensive.
So you get people diagnosed with diabetes, they develop what we call ketoacidosis, and they die.
Yeah, most actually report with the DKA.
DKA, yeah, diabetic ketoacidosis. So we'll just tell people as well, if someone gets type 1 diabetes and they don't get insulin, they get this condition called diabetic ketoacidosis. They'll become very sick, they'll go into a coma, and if you don't get insulin, you're going to die. And it's sad to learn that insulin was discovered in 1922. And it's still sad to learn that Wefwafwa doesn't have the insulin that he needs to treat all of his patients in 2021.
Amen.
And high blood pressure is quite common, Wefwafwa.
Yeah, high blood pressure is common.
Are you able to treat that when you diagnose?
Yes, I am able to treat it once I diagnose it. But as I told you, most people report with stroke and other complications actually for the first time. They rarely screen.
Yeah. So ideally what we want to do with high blood pressure is detect it at a very early stage. If it's not detected, someone will have high blood pressure for several years. That will cause heart damage and they're very likely to have a stroke. So Wefwafwa's telling us that many people are only diagnosed when they have a stroke, not when they first have the high blood pressure. So are you screening for blood pressure in your patients now, Wefwafwa?
Yes, I'm screening now in the villages where I'm moving. I was able to get a blood pressure machine and then a glucometer. So I'm trying to do the screening.
Mm-hmm.
Yeah, but I thought I need more people to join me, and then I need like more equipment to do that, because me, I'm doing it for free, but not everyone will be willing to do it for free. So if I need extra support, then I have to pay the team I move with.
Yeah.
So right now I'm doing it alone, and people are many. I cannot just hand alone.
So we need more people to work with you. Well, why are you doing it for free?
Yeah, I'm doing it for free.
Why?
The reason as why I'm doing this is because I know these people cannot afford, but at least I was able to get a glucometer and then a blood pressure machine. So I thought that since I can help them with what I have, and that's what I try to do, because I cannot just look at people dying without me doing anything. That's why I wanted to start with what is available and help these people.
Mm-hmm. That's good, Wefwafwa. Right, thank you. And I believe we plan to do another video where you're going to show us some video of your work outside.
Oh yeah.
And we're going to learn more about some of the health conditions in your area.
Yeah, that's true.
We want to learn that. And will you please keep us informed about how the COVID pandemic progresses as well? Okay,
please. I will keep uploading even the daily updates of COVID-19 on my channel as well in our country.
And we'll put the links to that. Yeah. And if you're not too traumatized, you're more than welcome to come back and report here again. That would be good.
I'm looking forward to doing that.
Thank you, Wefwafwa. I just want to tell everyone watching that me and Wefwafwa have been planning this for about 3 or 4 days now. And we have had so much trouble with the communications and the internet and the facilities. I mean, Wefwafwa's only got his mobile phone. He does everything on his mobile phone. And he's had to go to his friend's facility to use Wi-Fi. So he's gone to a lot of effort to get this video to you. And I'm aware of how much work he's put into this. This is not casual, because Wefwafwa does not have the infrastructure to do this easily and readily, but he's put the effort in so that you and me can get educated on this. And we're very grateful, Wefwafwa. So thank you for that. God bless you. And I hope we're going to talk again soon.
Thank you very much, Doctor.
Thank you, Wefwafwa.
I'm so grateful.
No, it's our pleasure. Thank you.